Welcome to today's video. Have you ever missed your period and thought you were pregnant, only to be disappointed by a negative pregnancy test result? This can be a frustrating and confusing experience, but don't worry, you're not alone. In this video, we'll explore the reasons why you may receive a negative pregnancy test result even when you are pregnant, as well as other factors that can cause a missed period. Negative pregnancy test results. Despite being pregnant, many people believe that a negative pregnancy test result means that you are not pregnant. However, this is not always the case. A negative result can occur if you take the test too early, perform the test incorrectly, or have a medical condition that affects the accuracy of the test. In rare cases, you may even experience a phantom pregnancy, where you exhibit many signs and symptoms of pregnancy but are not actually carrying a fetus. Missed your period but got a negative pregnancy test result? A missed period is often a sign of pregnancy, but it can also be caused by other factors, such as stress, changes in weight or exercise routine, or underlying medical conditions. If you have missed your period but received a negative pregnancy test result, it may be because the test was not sensitive enough to detect low levels of pregnancy hormones in your urine. If you continue to miss your period or experience other symptoms of pregnancy, it is recommended to wait a few days and take another test or consult with your healthcare provider. False negative pregnancy test results. What could be causing them? A false negative pregnancy test result occurs when you are pregnant, but the test indicates otherwise. This can happen for many reasons, such as testing too early, using a diluted urine sample, using an expired or faulty test, having certain medical conditions or taking certain medications, or making user errors. Missed your period but received a negative pregnancy test result. When should you test again? If you have missed your period but received a negative pregnancy test result, it is important to wait a few days before taking another test. HCG levels may not have risen enough to be detected by the test yet. If you have irregular periods, it may be best to wait at least a week after your missed period before taking a test. If you continue to experience symptoms of pregnancy, it may be helpful to track your symptoms and discuss them with your healthcare provider. Received a negative pregnancy test result. Is this a bad sign? A negative pregnancy test result is not necessarily a bad sign. There are many factors that can affect the accuracy of the test, such as testing too early or using a diluted urine sample. However, if you have missed your period and continue to receive negative test results, it may be a sign that you are not pregnant or that you have an underlying medical condition affecting your menstrual cycle. If you are trying to conceive and have been unsuccessful after several months of trying, it may be helpful to track your ovulation cycle and discuss any concerns with your healthcare provider. Could your medications be causing false negative pregnancy test results? Certain medications can interfere with the accuracy of pregnancy tests, leading to false negative results. Medications that contain HCG, such as some fertility treatments, can cause a false positive or negative result. Additionally, medications that affect hormone levels, such as birth control pills, can also impact the accuracy of pregnancy tests. It is important to inform your healthcare provider of any medications you are taking when discussing potential causes of a false negative pregnancy test. They may be able to offer guidance on when to take a test or suggest alternative testing methods. Missed your period and can't retest. What should you do? If you have missed your period and received a negative pregnancy test result but are unable to retest, it is important to pay attention to your body and any potential symptoms. If you continue to experience symptoms of pregnancy, such as nausea or breast tenderness, it may be helpful to track your symptoms and discuss them with your healthcare provider. It is also important to consider other potential causes of a missed period, such as stress or changes in weight or exercise habits. If you have a history of irregular periods, it may be helpful to track your menstrual cycle and discuss any concerns with your healthcare provider. Getting an accurate pregnancy test result is an important step in making informed decisions about your health and potential next steps. Here are some tips for ensuring the most accurate result. Tip 1. Wait until after your missed period. It can take several days for hCG levels to rise enough to be detected by a pregnancy test. Tip 2. Use your first morning urine. The concentration of hCG in your urine is highest in the morning. Tip 3. Follow the instructions carefully. Each brand of test may have slightly different instructions, so make sure to read the package insert carefully before using the test. Tip 4. Avoid drinking too much liquid before testing. Drinking too much liquid before taking a pregnancy test can dilute your urine, making it harder to detect hCG. Tip 5. Consider testing more than once. If you receive a negative result but continue to experience symptoms of pregnancy or miss another period, it may be worth testing again in a few days. In conclusion, receiving a negative pregnancy test result can be a frustrating experience, but it's important to remember that there are many factors that can affect the accuracy of the test. If you have missed your period or are experiencing symptoms of pregnancy, it is recommended to wait a few days and take another test or consult with your healthcare provider. They can help you determine the next steps and provide guidance on potential underlying medical conditions or lifestyle changes that may help you conceive. Thank you for watching. Like, comment, and subscribe.